How to stay calm during a coronavirus outbreak. Method 3. Protecting yourself from infection. 1. Practice social distancing to help prevent the spread of COVID-19. Social distancing, or physical distancing, means limiting your contact with other people. Stay at home as much as possible, and only go out for things like grocery shopping or going to work. Additionally, ask if it's possible to work or do your schoolwork at home. If you decide to hang out with friends or family, limit the guest list to 10 or fewer people. Focus on having fun while at home. Play board games, watch movies, cook a big meal, go for a walk outside, or make something creative. Social distancing doesn't mean you have to avoid all socializing. Keep in contact with friends and family over the phone, video chat, social media or messaging apps. 2. Wash your hands frequently with warm, soapy water. One of the best ways to protect yourself from any contagious disease is to wash your hands. Wash your hands anytime you go to the bathroom, handle objects in public places, or are getting ready to eat or prepare food. Use warm water and a gentle hand soap and wash your hands for at least 20 seconds. Make sure to wash your palms, the backs of your hands, and between your fingers. When you're done washing, dry your hands on a clean, dry towel or paper towel. Use alcohol-based hand sanitizer if you can't get to soap and water. Carry some with you in your bag or pocket. Warning: some people claim that using warm air hand dryers can kill the coronavirus, but this is not true. It's okay to use a warm air dryer after washing your hands, but be aware that the dryer itself won't protect you from any viruses. 3. Keep your hands away from your eyes, nose, and mouth. Many viruses, including the COVID-19 virus, enter your body through the mucous membranes in your eyes, nose, and mouth. Avoid touching your face except when you're washing it or applying skincare products, and always wash your hands with soap and water first. If you need to touch your face and don't have access to soap and water, rub your hands with some alcohol-based hand sanitizer. 4. Stay away from people who are obviously sick. If someone around you is coughing, sneezing, or seems severely congested, keep your distance. Try to stay at least 6 feet, 1.8 meters, away from them at all times. This will reduce your chances of inhaling droplets contaminated with a virus if they cough or sneeze near you. Don't assume that anyone has coronavirus, especially if there are no confirmed cases in your area. Chances are, the people you encounter who are coughing and sneezing will have allergies, cold, or flu. However, it's always a good idea to keep your distance from sick people. Always wash your hands thoroughly after interacting with a sick person. 5. Get plenty of sleep and eat well to keep your immune system strong. Taking care of your overall health can reduce your chances of getting sick. Support your immune system by eating balanced, nutritious meals with plenty of fruits, vegetables, whole grains, and healthy sources of fat, such as fish, vegetable oils, and nuts and seeds. Make sure to get 7 to 9 hours of sleep if you're an adult, or 8 to 10 if you're a teen. Staying physically active can also boost your immune system. Try to spend at least 30 minutes a day getting moderate physical activity, such as walking or doing yard work. 6. Avoid unnecessary travel or travel to affected areas. As of March 2020, it's best to avoid unnecessary travel to help limit the spread of the virus. Additionally, the CDC recommends avoiding areas where COVID-19 is most active, like Europe, Italy, China, South Korea, and Iran. However, keep in mind that CDC travel guidelines update daily, so this could change. You can keep track of current coronavirus-related travel advisories here: https://www.cdc.gov/coronavirus/2019-ncov/travelers/index.html. If you must travel in an affected area, avoid contact with sick people and wash your hands frequently with soap and warm water. If soap and water aren't available, use a hand sanitizer that's 60% to 95% alcohol. 7. Call your doctor if you develop fever, cough, or shortness of breath. These are the common symptoms of COVID-19, though you may also experience other respiratory symptoms. Contact your doctor immediately and tell them your symptoms, your travel history, and whether or not you may have come into contact with a potentially infected person. Your doctor will tell you if you need to come for testing. In the meantime, stay home so you don't risk infecting others. If you experience these symptoms, don't panic. Unless you live in an area where the coronavirus is widespread, you probably don't have a coronavirus infection. Your healthcare provider will have up-to-date information on the coronavirus and can give you the best possible advice. If you feel sick, protect others by staying home as much as possible, washing your hands frequently, and covering your nose and mouth with a tissue or the crook of your arm when you cough or sneeze. Tip: don't go to the doctor before calling first. They will likely isolate you to protect other patients and staff members if they suspect you may have COVID-19.